Good morning, everyone. My name is Najah Alamrani. Today I present our study titled Determinants of Nurses' Job Satisfaction Systematic Review. Nurses represent the largest group within the healthcare force and play a crucial role in maintaining patient safety and quality of care. However, job dissatisfaction among nurses has become a growing concern worldwide, as it is strongly associated with burnout, staff turnover, and reduced quality of healthcare services. Therefore, understanding the factors that influences nurses' job satisfaction is essential for healthcare organizations aiming to improve workforce stability and patient outcome. In this presentation, I will summarize the key determinants of nurses' job satisfaction based on the recent evidence from published studies. That the sustainability and the effectiveness of healthcare system are closely linked to the stability and engagement and well-being of the nursing workforce. The global reports highlight ongoing challenges, including nursing shortage, workforce maldistribution, and increasing workforce demands. Job satisfaction is strongly associated with burnout, turnover, intention, quality of care, and patient safety. Despite the growing of body research on nursing job satisfaction, existing evidence remains fragmented across different healthcare settings and regions. A variation in methodology, approach, and measurement instrument, conceptual framework, limited ability to identify the most consistent determinant influencing nursing job satisfaction. Therefore, systematic synthesis of recent empirical evidence is required. This study aims to do the systematic review to identify recent empirical study or evidence on nursing job satisfaction, evaluate the methodology quality of the including studies, synthesize determines influencing job satisfaction across healthcare setting. This review is focused on the study published between 2019 and 2024, determined the key determinants influencing nursing job satisfaction across different healthcare settings. This study was conducting a systematic review to identify the key determinants of nurses' job satisfaction. The review was conducted following PRISMA 2022 guidelines to ensure transparency and methodology rigor. We researched several electronic databases such as PubMed, Scopus, Senile, and Web Science to identify relevant peer-reviewed studies published between 2019 and 2024. The study were including if they focus on nursing working in clinical setting and examine the factor associated with job satisfaction. After applying the inclusion and exclusion criteria, the selected study were critically reviewed and the main determinants of job satisfaction were synthesized. Moving to the result, a total 20 study met the predefined inclusion criteria were incorporated to the final synthesis. The evidence base reflects the methodology heterogeneity, including inequality, cross-sectional study 12, systematic or literature review 4, observational or multi-center analytic study 3, policy-oriented workforce analysis 1. The majority of this study were conducted in acute care hospital setting. Sample size range from approximately 120 or more than 4,000 participants. This study were conducted in various regions including Asia, Europe, North America, and Middle East, and Australia. These studies were published between 2019 and 2024. The methodological quality range from moderate to high according to the GPI, critical appraisal tool. Determinants of nursing job satisfaction were grouped into three main categories. First, organizational factor, these including leadership style, staffing adequacy, organizational support, and opportunity for professional development. The findings showed that supportive transformational leadership were constantly associated with higher job satisfaction, while insufficient staffing and poor communication were linked to that dissatisfaction and higher burnout. Second, work-related factors. These mainly involve workload intensity, shift patterns, and scheduling practice, and the availability of resources. High workload rotation shift were frequently associated with the psychological stress and lower job satisfaction, with the burnout acting as important mediating factors. Finally, individual characteristic. This shows more variable association with the job satisfaction, satisfac- demographic factors such as age, experience, were not constantly related to satisfaction. Personal resources such as resilience and coping strategy were associated with a higher job satisfaction and lower burnout. Moving to that discussion, the finding of the review suggests organizational and work-related factors play a central role in shaping nursing job satisfaction, in particular supporting leadership. Adequate staffing and positive work environment were constantly associated with a higher satisfaction level. At the same time, high workload, rotating shift were frequently linked to stress, burnout, and lower job satisfaction. This finding highlights the importance of organization strategy that support nurses through effective leadership, appropriate staffing policy, and supporting work environment to improve both workforce and stability and quality of care. In conclusion, this review synthesized the empirical evidence published between 2019 and 2024 in nursing job satisfaction. Nursing job satisfaction, multidimensional constructor shaped by organizational, work-related, and individual factors. Organization determines particularly leadership, style, management, support, staffing adequacy, and organizational culture were the most constant and influencing predictor. Work Work-related conditions such as workload intensity, shift pattern, and work-life balance significantly influence satisfaction level. Individual characteristics shows comparatively less constant association. Improving nurses' job satisfaction require systematic and policy level intervention based on leadership development and evidence based staffing strategy and support work environment. Thank you.